Hi, I'm Dr. Steve Schlozman. I'm a child psychiatrist and a consultant with the New York State Project Teach program. I want to take a minute to talk with you about some of the changes you may want to look out for when it comes to your child's mental health, specifically if your child is between the ages of 0 to 5. It's important to utilize your child's pediatrician for mental health concerns, as well as other kinds of illnesses. Remember, you know your child best, but your doctor knows how to recognize an emerging problem. In other words, you might not be sure if there's a problem, and that's what your doctor is there for. Your concerns as a parent will obviously change as your child grows, but right now I'd like to share some questions to think about if your child is under 5. During these beginning years, your child is mastering all the things most of us take for granted: sleeping well, eating appropriately, relating to others, using words and being able to tell stories. These are the ways humans interact. And amazingly, we master these tasks in the first 5 years of life. Because of this, try to focus on the really basic things. Look at sleeping, eating, talking, and playing. Remember, these are only rough guidelines. Shape your thoughts based on what you know about your child's unique needs. For sleep, ask yourself, does your child sleep through the night? If not, how often does he or she wake up? How long does it take your child to fall asleep or to fall back asleep? Does your child have nightmares? Does your child remember the nightmares the next morning? Remember, very young children, and certainly infants, won't know how to describe a nightmare. Some children will even have a hard time knowing that an unhappy dream isn't real. Think about whether your child wakes up in the middle of the night feeling extremely frightened or sad. If this happens often, does your child appear to remember these events the next morning? Does your child ever wet or soil the bed? If so, how often? When does this happen? What is your nighttime routine? Does it vary? For eating, keep these questions in mind. When does your child eat meals? When does your child snack? What does your child eat at meals and at snacks? Is your child a picky eater? What are some favorite foods? For speech, decide. Is your child a big talker? Have there been changes in your child's vocabulary? Can you understand what your child is saying? Does your child tell stories? Can your child understand what you're saying? Will he or she listen to your stories and ask questions about them? Can your child follow instructions? How many steps of instructions can your child follow? For play, watch your child and consider, how does your child play? Do they play with friends or next to friends? Does your child have a best friend? Does your child have a group of friends? Does your child have an imaginary friend? Does your child draw? If so, what does your child draw? Does your teacher or child care provider have any concerns about your child? Does your teacher worry about your child's ability to pay attention? And finally, for family and family changes, ask yourself, is there any chronic family stress, or has a significant life event taken place within your home that may affect your child's well-being? For example, separation or divorce, moving to a new home or community, the birth of a child with special needs, or a serious medical diagnosis in the family. Make sure to let your child's pediatrician know if these or other significant changes are occurring in your family. Remember, there's no wrong answer to these questions and no answer that guarantees there's a problem. But if your answers make you think, look at your thoughts as an opportunity to ask more questions, and definitely involve your doctor in these discussions. To find more information about what social and emotional developmental milestones children reach at this age, take a look at the Guide for Parents of 1 to 5-Year-Olds. It's a brochure on the Project Teach website.